I treat a variety of wounds. Primarily I see pressure ulcers and vascular ulcers, as well as venous disease, and then a variety of conditions that may be a result of patient comorbidities, infections, immunocompromised wounds, and skin conditions as well.
For the most part, whenever a wound has necrotic tissue, we do a wound debridement to remove that necrotic tissue so that the risk of infection is less. But we can also do biopsies of wounds to see if there's other etiologies that may be preventing that wound from healing.
Wound care, especially in the elderly, it's really a patient population that's in dire need of help in a time when they're most helpless. And it's very tangible, the results that you get.
My best moment in this practice is when I'm able to tell the patient, your wound is healed and I don't need to see you anymore.
We interact with a patient population that's sometimes underserved, and there's a lot of gratitude both from the patients and their families whenever I can actually improve their wounds and watch them get better.
As a general surgeon, I was working over 100 hours per week. I was on call every other night. My work schedule was unpredictable. As a wound care specialist, I now have a predictable schedule. I work 5 days a week. I average about 45 hours a week, and I have time for myself and for my life outside of work. The Vohra team provides an excellent comprehensive training in modern wound care. It goes into both didactic background on wounds, on chronic wound care. You learn a variety of treatment modalities that might not have been exposed to previously.
As a family practitioner, we get to do a lot of procedures whenever we have our residency training and in our own practices, and those transfer very well to doing wound care. You can take those procedures and those things that you know how to do, and Vohra wound physicians provide you with a training period anywhere from 3 weeks to 5 weeks where they teach you how to apply those to wound care and provide services to patients.